Hello, everyone, and welcome to Chat Night Africa Live. Chat Night Africa Live. Today, we are handling some tough, sensitive issues. Chat Night Africa Live from Washington, D.C. metropolitan area. On Chat Night Africa broadcast today, we have Dr. Adeline Nukuna. She is connecting from the great state of Delaware. This is Chat Night Africa Live. I'm coming back. This is Chat Night Africa Live from Washington, D.C. metropolitan area. On Chat Night Africa today, we'll be talking about sex matters, sexual disorders. This is Chat Night Africa. In just a moment, we'll be connecting with Dr. Adeline Nukuna from Washington, from Delaware, state of Delaware. Chat Night Africa Live.
We're gonna party, party hardy. We're gonna boogie, boogie woogie. We're gonna dance, side to side.
This is Chat Night Africa Live, and your host is Divine Chamukong.
I'm ready, I'm coming, I'm ready, I'm ready to get.
If you have children around, please move them away.
I'm coming.
The content not for anyone below the age of 18. This is Chat Night Africa Live.
I'm coming. We're gonna dance. We're gonna dance. I'm coming back.
I'm coming back.
I'm coming back.
Right here, I'm with you for yet another breezy broadcast. Chat Night Africa Live from Washington, D.C. metropolitan area. In just a moment, we will be connecting with Dr. Adeline Nukuna from Delaware.
We're gonna get down. We're gonna get down. We'll party. We party hardy. We'll boogie. We boogie woogie. We'll dance. It's side to side.
Hello, everyone, and welcome to this edition of Chat Night Africa Live. We have an interesting broadcast for you, and so please hang on. Can you imagine having a plate of delicious food in front of you and yet unable to eat? Well, maybe because of toothache. It isn't that you are not able to, you just cannot eat. Today, we talk on a subject many people would rather avoid, even behind closed doors. Listen, my dear friend, no problem ever goes away because you don't want to talk about it. To quote Minister Veronica Fortune, men don't want sex, men need sex. So my friend, today we call a spade a spade. If you have children around you, please move them away. And before we start, get this. And as this song goes on, we'll be trying to get in touch with Dr. Adeline Nukuna. And this is Timon 40 in the song Men Sessi. Dr. Adeline Nukuna, I see you on the line in just a moment. We'll be connecting with you in Delaware. Share, invite your friends, start your friends. Boom, Paka, Bouger, Sakai. Come on, oh my God. And Timon 40 with the song Mensensi. In just a moment, we'll hook up with Dr. Adeline Nukuna. Invite your friends, tag your friends, share this broadcast. This is Chat Night Africa, and your host is Divine Chamukon. Okay. Share this broadcast. Share this broadcast. We have powerful stuff for you. All right. Thank you again for coming on, and we want to appreciate everybody who is online now watching this broadcast. Ladies and gentlemen, we are now hooking up with Dr. Adeline Nukuna. She is joining us from the great state of Delaware. Dr. Adeline Nukuna appears on the screen to take some questions about sexual matters that many people do avoid. Hello, Doc. Good to see you again.
Hello, Mr. Chamakong. I'm back on the air.
Very good. Thank you so much for connecting from the great state of Delaware. First question, what is to be understood to mean sexual dysfunction?
You know, sexual dysfunction basically is just a condition that will interfere with the way sex was designed to function, both anatomically, physiologically, psychologically, and emotionally. That's the way I look at it. It's a whole package. So if you look at sexual dysfunction and you look at men, sexual dysfunction in men, you know, is characterized in three different areas. Number one, you have decreased libido, which libido is a word for sexual desire, right? So men will have a decrease in sexual desire. Now, the other thing is erectile dysfunction, and that is a big problem as well. And thirdly, sometimes men will have problems with ejaculation, which we refer to as ejaculatory problem. Now, let's look at it from a woman's perspective. For women, you know, any aspect of their sexual function that causes personal distress is considered, you know, sexual dysfunction. So for women also, just like for the men, a decrease or a lack of sexual desire is, you know, it's a problem. Sometimes they might have a problem with arousal, so they have impaired arousal. And how many times have you heard women say, you know, I have never attained orgasm? They might have an orgasmic dysfunction. And a very big part or a very big aspect of sexual dysfunction in women, Mr. Chamakong, is pain. You know, both in the younger population and in the older population. The thing that causes the pain might just be different. So sexual dysfunction is really a broad scope, and it's a very important thing that we all have to talk about, because guess what?
Well, let me cue up from where you talk about pain. Sometimes when women have pain during sexual intercourse, they could be thinking that maybe the man's penis is just oversized for them. When do you really begin to think that the pain is as a result, it's a sexual dysfunction, not because of the anatomy of the man?
Well, you know, Mr. Chamuko, I have to acknowledge that what you have said is really true, because sometimes, you know, pain can be a consequence of the size, right? And so that's actually one of the causes of pain. But not all pain is because of that. Because sometimes even in men who are, or even if people have sexual relations, in men who are not well endowed, they can still have pain. And let me tell you where the pain will come from. The pain comes from several different factors. Let's look at the woman. A lot of it can really be because of the woman. And a lot of it can be gynecologic in nature, and some is psychological in nature. A big component is the gynecology aspect of it, because sometimes women have certain conditions that can predispose them to pain, especially with deep thrusting. I'll give you an example. There's a condition called endometriosis. that will cause pain sometimes with deep penetrative intercourse. Some women have what we call fibroids of the uterus. And women with fibroids really can have pain with intercourse as well. You know, if you look at the older population, they have pain with intercourse, but it comes from a different set of problems. Because the older a woman gets, the less they produce the female hormone, estrogen. And I'm going to try to just keep it simple and leave out a lot of the scientific things out of here. But once they don't have that hormone and they get older, their ovaries don't really produce as much estrogen anymore. So they develop problems, vaginal problems. So they have dryness of their vaginas. They lose what we call the rugae aspect of the vagina. The tissue of the vulva and the vagina become very thin. And with all that, intercourse becomes painful.
Thank you for those pieces of information. Again, the reason we discussed this topic, Dr. Adeline, you realize that a lot of people just avoid it. The couples don't talk about it. And because of that, when one partner is not satisfied, the tendency is for the other one to go cheat, or sometimes worst case scenario, you have a divorce. Now, it's to avoid the issues of cheating with its attendant consequences, the problems of divorce, that we thought that we should put all this on the table today and call a spade a spade. Again, if you have young people around you, move them away. Let me ask you a little bit of a question about what I hear women complain a lot about, premature ejaculation and poor erection. And again, we can quickly point this out because of the anatomy of the man.
Yeah.
When do you say a man ejaculates prematurely? After beginning sex and going on for how many minutes? 1 minute, 2 minutes,
within
5
a minute.
minutes?
If they last for 5 minutes, that's not premature ejaculation. So a man begins to have sex, and within a minute of having sex, the man ejaculates. That is premature ejaculation. But let me tell you about another component. I think sometimes we focus so much about ejaculation. Ejaculatory disorders, Mr. Nchamukom, is actually just one aspect of a sexual dysfunction in a man. It's not only premature. Sometimes you can have what we call delayed ejaculation. You can have retrograde ejaculation. You can have no ejaculation at all. Now, a lot of the ejaculatory disorders come from both organic and psychogenic factors. Now, the two other groups of sexual dysfunction that we also have to focus on, that I mentioned earlier, you're talking about decreased libido, right? Which is decreased sexual dysfunction. And you're talking about erectile dysfunction. And a lot of the causes of some of these things are really us. Like you're saying, people don't want to talk about it.
What do you mean?
Well, I say it is really us because let's focus on the men for just a second, right? If you look at the literature, let's make a few notes here. Let's look at decreased libido. It's very rampant. Up to about 15% of men would tell you that they have decreased libido. And it is something that increases with age. But I can tell you that there are a lot of things that cause it that are really within our control. I'll name a few examples. Alcoholism, right? How many times in Nchamukom have you heard women say in a party to their husband or their boyfriend or their significant other, oh, please don't drink too much because it's going to kill your thing. Have you ever heard that?
Sure.
Right. So, alcoholism will cause that. Depression is going to cause that. Smoking will cause that as well. Relationship problems and stress will cause decreased libido. Recreational drugs will cause decreased libido. Sometimes just the fear of humiliation. For whatever reason, the man might be scared for whatever reason, like, oh my God, I don't want to do it with her, or I'm not well endowed. What is she gonna think when she sees me? I don't feel comfortable. And guess what? Once you start having those fears, sexual desire suffers. Now, having said that, it doesn't end there. Sometimes, unfortunately, some of the medications that are used to treat certain medical conditions can also cause a decrease in sexual desire. And sometimes people with systemic illness, will get that. So let me give a couple of medications that can cause that. Like, for instance, some antidepressants can cause that. Some high blood pressure medication can cause that. And then sometimes the decrease in sexual desire is just a natural process, because as the man gets older, testosterone level decreases, and guess what? Sexual desire suffers. And I'm bringing all this point because you talked about what an impact sexual dysfunction in a relationship can have on a relationship. It can result in a relationship breakup. It can result in cheating. It can result in divorce. And if you listen to all the factors that I point out to, can you imagine how many of them are within our control?
I can see that.
So you see what a nagging husband can do to the wife, and you see what a nagging wife can do to the husband, right? So
you're not to talk about that. I mean, I watched this show on Oprah Winfrey.
Oh, you did?
You had this robust guy, and a beautiful woman. They were looking at themselves like strangers, like two roommates under one roof. They were just not having sex because of a lot of debt. And so, even though I'm not a doctor, talking from the psychological perspective, I would say, please, if you cannot pay that mortgage, if you cannot pay that monthly payment, your mortgage, don't go look for a house and sleep there and you can't touch your wife. You are looking at your beautiful wife as a piece of art, as a work of art in your bedroom. Just because you're worried about where you are hallucinating, you're worried about where to get the next payment, or you go get that Lexus fully loaded or Mercedes 500 to impress people, and then you are driving inside, you go park the car, and you cannot have sex with your beautiful wife, and very soon one person is cheating. So these are the psychological angles. Let me ask you something about premature ejaculation, because I've heard women complaining a lot about that. This man comes in, they're hot, they're ready, they want to tear down each other. The man starts, and within a minute, he's off, leaving the woman there very frustrated. And most times, the man too is very, very frustrated. Now, could it be the question? Could it be the excitement of meeting a partner, especially for the first time, or infrequent sexual activity with that partner? What could also cause premature ejaculation?
Well, it could be the first two things that you mentioned. One thing might be excitement, where you haven't seen, can you imagine when you just start dating somebody, you're so excited, and the first time you guys get intimate, that alone in itself can just, cause you to, to ejaculate prematurely. Sometimes it might be because it's been a while that people have been apart, and then that happens. But sometimes the divine is actually, a problem in itself, like a problem, like I mentioned, with some of the problems of ejaculation. If there's a damage in any way to the nerves that really supply the organs in our body that play a role, or in men's bodies, let me say, when I say us, I'm talking about us humans, supplies the organs that participate in the ejaculatory process, that in itself can create a problem with premature ejaculation. But we also have to understand. Let me tell you something, and it's kind of nice that we're talking about this. We really don't have to focus so much on ejaculation. Sex is not all about ejaculation, right?
Some men will say, no, it is about it.
and remember,
so, believe me, I can imagine.
I have to make a note of that one, because I have to come back to that one. I have to make a note of that one.
Okay, Doc. Okay,
no, keep talking. I just have to make a note about that.
No, I say I can imagine this woman who has been prepared and the foreplay intense, and the man starts. The woman is so hungry to get more, maybe for the thing to run on for an hour, maybe 30 minutes, 45 minutes, and the guy gets on top, and very soon he's coming down. This can be this just drives people nuts.
Nidhi, and that's the whole point, because sex is not supposed to be about ejaculation only, because people can really have sex for 45 minutes, and guess what? It's not all about penetration and ejaculation, which is what brings me to another thing. I mean, if you look at it, let me just clue in a little bit more. If you look at men,
and before you throw in that, I like to inform the audience, please. We want to make this interactive. What are you hearing? Not necessarily the problem that you face. What are you hearing from your friends? What are the complaints that women, especially married women, are complaining about? Men, what are you hearing? So please post the questions, and I'm going to relay the questions to Delaware right now, to Dr. Adeli Lukuna, who's my guest today.
Let's talk about this, New Divine. This is getting really exciting and interesting, because I'm going to go back to this thing about premature ejaculation. Sex does not really have to be about that. And the moment you think that sex is only about that, then there's a problem, right? Because this can really create sexual dysfunction in women. Remember, I said that any aspect of a woman's sexual life that causes a personal of a woman's sexual life that causes a personal distress can really be considered that. So if you look at, for instance, men and women, right? Men generally report, more sexual activity and good quality sexual activity than women. This difference actually widens as people advance in age. It is particularly seen in men who are like maybe 75 to 85 years of age, where about 39% of those men will report satisfaction with sex, and compared to only about 17% of women. Why is this the case? Now, if you look at it, a relationship duration, generally, believe it or not, be divine, the longer a relationship persists, sex is not as rampant as it was in the beginning. I mean, the men who would the relationship where it will continue to be at a level, the studies have shown that over time, the number of sexual encounters decrease. But guess where the tables turn? Men, generally, for men, tenderness decreases over that duration, and for women, tenderness increases, because sex is not just about ejaculation and penetration. Sex has several components, right? There have to be a foreplay, there have to be tenderness, right? Both parties have to get into the mood before there is penetration. So, so what I'm trying to stress here is that there are certain aspects of sex that are dysfunctional, that are not necessarily ejaculatory in nature. Some of these aspects we really can have control over. And sometimes people might develop illnesses that prevent them from having ejaculation or from sustaining an erection for long, right, for the guys. But it doesn't mean that the sexual life has to end. They just have to be open and honest, and they can have sex in different ways. They can have sexual acts in different ways.
Now, but what are you going to tell this woman who is complaining about the weakness in erection of her husband or her boyfriend? Because on this show, the truth is, we're not only addressing married people, because the reality is not only married people have sex. Okay, so we're talking to everybody, and as I said, we're going to put all cards on the table. We will call a spade a spade. Okay. This woman will want a rock hard penis. She's not getting it. What are you going to tell her? What should the man do?
Well, guess what? It depends on what is causing it, right? It depends on what is causing it. So the question then becomes, it's like diagnosing a sexual dysfunction. First of all, you have to figure out what is causing it, right? What is erectile dysfunction? Basically, it is a consistent and recurrent inability of a man to sustain an erection of sufficient rigidity, or what you call hard, for the duration of sexual intercourse, right? So several different things can cause this. So what would I tell a woman who tells me that? You know what I would tell her, Mr. Chamakong? I would tell her and say, you know what, first we need to figure out what the problem is. Well, I'm not going to figure out with the lady, but...
You're not going to tell her to go tell her husband to eat a lot of bitter cola.
No, that's not what I'm going to say.
I hear so much about bitter cola. I don't know.
No, Mr. Chamakong, because if the cause or causes of the erectile dysfunction is not bitter cola, you can give all the bitter cola you want. So another lady will enjoy. Another lady will enjoy the consequence of that bitter cola, and not you, right? And not you. So before you give the bitter cola, make sure that it will end there with you. So why am I saying this? I'm saying this because erectile dysfunction is caused by several different things, right? Smoking can cause erectile dysfunction. Believe it or not, watching too much TV can also cause erectile dysfunction. right?
How about
Obesity,
pornography? I mean,
obesity.
some
No,
people expose.
obesity can cause erectile dysfunction. Depression can cause erectile dysfunction. Stress, like what you just told me that you watched an Oprah Winfrey show where a couple got married, but when their bedroom looking at each other because they're so worried about their debt that they had incurred when they got married. So stress, be it in the relationship, at work, or financial, can also cause erectile dysfunction. Now, having said that, I also want to say that some medical conditions can cause erectile dysfunction. An example would be hypertension, for instance, that can cause that. Diabetes, hyperlipidemia can cause that, right? And then not to forget medication. Certain medications that are used to treat certain health conditions, and I can tell you that some antidepressants are notorious for this, will also cause erectile dysfunction. So, Mr. Chamukan, guess what? If your man cannot sustain an erection, or like you said, the penis cannot stay hard, the question is, are you causing a lot of stress in that relationship? I mean, what's the relationship like? If I were to move the lady and bring somebody else in that relationship, would the man sustain an erection? If the answer is yes, then the man is stressed in the relationship. Maybe then you need to take the stress, right? If you take out the stressful
Mhm.
situation, that will solve the problem. And one thing I'm going to tell the guys is that you need to get out and exercise. Because, studies have shown that I am telling you, when you exercise, it actually lowers your risk of erectile dysfunction. So,
I have a question for
yes.
you. Beatrice
Mm-hmm.
Fominen asked, what about a nagging partner? Would that cause sexual fighting couples? Would that cause sexual
Yes, it
dysfunction?
will cause sexual dysfunction in men and in women. Because you know what? If you have a nagging partner, let's say you come home in the evening and you have dinner and your partner is nagging. When you go into your room, is sex really what is on your mind? Isn't it? On your mind, you're thinking, you know what? I just need to get away from her, or the woman will be like, I just need to get away from him, right? So that alone tells me that there's a problem. It's just a problem. It's a put off, if I can use that word. It's a put off. But guess what? If you're nagging your partner is going to go to where there's no nagging. I'm telling you that right now. And will only come. I
Well,
will only come to you.
you may want
So,
to
Mr.
avoid.
Chamko, guess what? I once heard
Yes,
a lady say that before you get into your bedroom, if you want a good night of sex, put your worries outside the door. Don't take your worries into your bedroom.
no controversial
Because
topics,
what? No,
no finance
no
matters.
controversial topic, no stress.
No, what about the bills?
leave them, leave them all out of the bedroom. Honestly, a nagging partner is really a put off sometimes because all you want to do is just get away from that partner.
And honestly, I'm not a woman, never have been one, never will be
Mhm.
one. But I can imagine that a battered wife, husbands, men, if you spend time cussing out your wives, your partners, I'm not so sure. I mean, you're a woman, Dr. Deline. I'm not so sure how desirous that woman would be of having sex. I'm not sure.
And that's the very bad thing. I'm glad you brought that up because guess what? One of the main causes of of a lack of sexual desire, lack of libido, as we say, or decreased libido, is actually a history of sexual abuse, a history of physical abuse, and in this circumstance, verbal abuse. Because words are very powerful. We have to use our words wisely. If you remember, when I talked earlier about one of the causes, I talked about humiliation, and you can project and say your self-image. If somebody constantly insults you and makes you feel like you're not good enough, or this woman is better than you, or I saw this one, they look better, or they look at, or you're driving with them and they're looking at other people, if it makes you not feel good about yourself, the tendency is that guess what? When the light go off, if you do it with the light off or the light stay on, if you do it with the light on, guess what? That woman will be so self-absorbed and will be worried about, oh my God, what is he gonna say about my love handles, when he sees them? What is he gonna say about my drooping breasts when he sees them? What is he gonna say about this little wrinkle that I now have developed? And that alone can make the person to kind of recoil and really lose interest because now they're more concerned about self-humiliation because of what you've been telling them.
But I've heard women, because when we designed or thought about this
Yes.
topic, I went out. It wasn't really a scientific survey, but I wanted to talk to many women, as many women as possible, to see where they're coming from when they say that they are not satisfied sexually. And it's amazing how many married women, and I'm talking about
I
married women,
agree.
who are married and not satisfied at all.
Yes.
Some married women don't even know what it's called
That's
orgasm.
true.
They have never heard it. They have never
Right.
heard it. But here's what a woman told me, that, and I'm going to say it as it is, as
I
she
think you
told me,
should.
that the penis of her husband, it's just very small. And so she's not feeling the pressure inside her. So the question is, you have women who also complain that the man is like a horse. So what do women want?
I am going to tell you something, Mr. Chamakong. Sometimes I totally agree that size.
Is it the size that does the
wait,
work?
let me finish. I got to finish. Let me finish my thought. Otherwise, I'm going to have to jot it down. But it is true that size matters, right, the divine? But I'm going to tell you one thing. What matters is not the size. The size matters, but what matters even more is what you do is what you've got. Am I correct?
No, I got the,
yes,
I got the point.
What you do with what you've got.
I also talked to men.
Okay, what did the men tell you?
The men said, Dr. Deline, that they just don't know how to tell this woman that their wives are just not clean.
Well, guess what?
Yeah, that it's just a turn off in the bedroom.
But, Mr. Chamukong, you know what? And this is what the problem is. That is exactly why I told you that many of the causes of sexual dysfunction are within our scope to change them. And this is the problem when people don't talk about sex. This is the problem when people don't talk about their intimacy, right? If your husband does not have a sexual desire, if your wife is not getting aroused, or if your husband cannot sustain an erection, what you should be doing is not sitting there and wallowing in a corner and trying to figure it out in your head. That is what.
Or go complain to a colleague at the workplace.
No, wait. Or go complain. That should really be a no-no anyway. That should really be a no-no. So sitting there and fantasizing about somebody else when you're having sex with your husband. The issue is people need to be very open and honest with each other. One of the biggest ways to solve the sexual dysfunction issue in a relationship that are within our control is open, honest, and direct communication. Where you sit down and you say, you know what, dear, I kind of like it when you put that perfume on, when you go to bed, or the other day when you sprayed that perfume, it was really so nice. I really liked it because that really got me going. It really aroused me, right? And guess what? That's what the lady would do. So you're not really telling her that she's dirty. You're finding a nice way of telling her. Are you with me? Now, on the other hand is, like I've heard Minister Veronica Foshu talked about wearing sexy lingerie, right? So guess what?
Right.
If a man or even a woman likes a certain kind of boxers or underwear for the husband, why don't you just get it and bring it to them? Or if you buy one and the wife wears it, or if she wears something, you can say, you know what? Oh my God. Oh, sex was so nice last night because when I saw you in that underwear, that was the one thing that just got me going. Mr. Chamukong, don't you think the very next day that woman will find herself in that store getting some more of those underwear? So instead of going to work and complaining to your colleagues, instead of wandering around in a corner, instead of sitting there and not enjoying a good quality sex life in your relationship, I think you should sit with your partner and have an open, honest relationship and discuss what it is that makes you tick. Once you find out what makes you tick, then you do it.
One woman I talked to, Dr. Deline, and in case you just joined the broadcast, this is a Chat Night Africa special broadcast. I'm your host, Divine Chamakong. My guest is connecting from the great state of Delaware. That's Dr. Adeline Nikuna, MD and PhD. We're talking about sexual dysfunction. Why a woman all of a sudden just loses sex? Or the man has a beautiful wife at home, but looking elsewhere. Like you go to a restaurant, they bring you food, and you are looking at your neighbor's dish. So these are the things, and we decided we had decided that we will call it as it is. Now, Dr. Adeline, I met a lady. I was talking to her what her concerns are, and she's watching this broadcast, and she says apparently her husband likes what you people call the thong, the kind of inner underwear. Right. In Europe, they call it, I think, sling, the kind of pants underwear that, you know. But she says when she brings it home, the husband is thinking that she is a prostitute. Where do you get this idea from? Where? So what?
The husband doesn't know what he wants. You cannot tell your wife that you like tongues, and then she goes and buys tongues to be able to, fulfill that sexual intimacy or whatever thing that you like, and then you turn around and call her a prostitute. You can't eat your cake and have it. Then I can tell you that husband really does not know what he wants, and not only that, he is looking for an excuse to go out and sleep with other women, and that's why he's doing what he's doing. So that excuse to me that is tautology.
I think sometimes, Dr. Adeline, this comes down more. I mean, there are lots of these sexual dysfunctional problems that can be handled by couples.
Absolutely.
Or people involved in sexual acts.
A lot of them, Mr. Chamukon, a lot of them. Because I can tell you that we all know that as couples get older, men, physiologically, testosterone goes down. They get erectile dysfunction, not because of any extraneous factors, but just by the very nature of their physiology. Women get sexual dysfunction just by the very nature of growing older sometimes, in some circumstances. We talked earlier about, getting older, the ovaries producing less estrogen, the woman developing, vaginal dryness, the vulva and the vagina become very thin, and intercourse becomes painful. Now, this leads to another form of sexual dysfunction where they don't desire to have sex. So even in these circumstances, if in a couple or couple who really understand each other, they have to talk with each other. They have to educate themselves, or they have to be educated that these are natural processes in life. It's not because somebody's cheating. It's not because somebody doesn't love the other. And once they acknowledge that some of these things are things that just come with age, they will look for other ways to have sexual satisfaction. Mr. Chamukon, I'm telling you that sexual satisfaction is not only about ejaculation. So they will look for other ways of fulfilling their desires. And sex can be very enjoyable.
We'll talk about treatment. And it's important we talk about these things, because even the churches, I see Reverend Babila Fochang watching. I don't know how much of sex is taught or talked about in the Presbyterian Church in
Reverend Babila, please. Reverend Babila, I would like your contribution. So please, I would like you to chime. Reverend Babila, I would like you to chime in on this topic as well.
Very good. And please, if you know of issues of sexual dysfunction, psychological or physiological, please let us know. Put your questions, and Dr. Adeline Nukuna, who is a gynecologist and obstetrician, will answer. She's connecting with us today from the state of Delaware. Now, maybe women should also understand that the man you married in his 30s, when both of you when you get to 60, you don't expect this guy. Don't get somebody have heart attack because you want him to overperform. We'll talk about the treatment. What can we do to help people when some people go to the pharmacies and buy stuff? Some people go on the internet and watch all kinds of, bitter cola. Africans are well known for eating bitter cola. Some people say they drink Guinness and it works for them. No, I don't know. I'm not recommending.
Is that what you did?
I have to make that disclaimer here. I'm not a medical doctor. I'm not a dietitian, so I don't know what foods have. I'm not going to share with you my personal experiences. You can call me. I talk about that offline. But what should people really do? Let me ask you this, Dr. Nikuna. Do people always come to you and say, look, we have this problem? And are people open when they're having all these sexual difficulties in their bedrooms? Are people open when they meet you, doctors?
Unfortunately, it's a topic that many people really don't want to talk about, and they're not open about. And that is why it is, every physician, to make it a point, every physician in primary care, or, in a specialty like my specialty, urology, they should make it a point to make their patients comfortable to talk about this. So, for instance, during their well-woman visit, a physician should really make a woman feel comfortable, to talk about any sexual problem that she, or they can make the man feel comfortable. They should make the man feel comfortable to talk about any sexual problem that they are experiencing, because if the patient really have to create this milieu, because that's not a topic that somebody just comes up and say, hi doc, oh, my husband really, has erectile dysfunction. They don't come to you and say that. You have to make them feel comfortable so that they should be able to talk to you. Because in many instances, education can make a big difference in people's bedroom lives. So it is very important that, and the one thing I like to address before we forget that I kind of wrote down that you just said, and that is about people going on the internet, like you said, people just go on the internet, you know what? Oh, I don't want to go talk to my primary care doctor about, getting that thing to help me. I'm just going to put on my computer, go to the internet, look at this wonderful thing and just order it. And it comes in a sealed thing and then you hide it. My advice to people is that people should buy these things with great caution, because there's no guarantee that, number one, the amount of ingredients that are in them are at the level that is recommended, or above the level that's recommended. That's the first thing. The other thing is that the safety of it is not guaranteed. So I would tell people to really, honestly stay away from these things. Get it with caution. If you're having any issues with sexual dysfunction, find where your doctor is. Go and talk to your physician. Go and talk to a healthcare provider, so that together you can work with the healthcare provider to be able to, number one, identify what could be causing this, or is or are causing this, and then come up with an appropriate plan of action.
Maybe also for men who get very excited, or you have this wonderful mouth-watering dish, beautiful woman in front of you, and you like, oh, like, my God. Come on, women maybe want to get that temperature drop. Just chill. Because what's going to happen is, the likelihood is you're meeting this woman with such speed, fast and fury, and then you ejaculate prematurely.
Okay.
And then everybody leaves unhappy.
Well,
everybody's unhappy in the whole exercise.
If you ejaculate, then why are you unhappy? It's the woman that I'm going to be more concerned about than you. Because not you, Mr. Chamukong, the man that is,
But what do you tell people? Because some people argue. I've listened to a lot of your colleagues, and I listened to even pastors, priests. They are not so keen on advising people to watch pornographic movies. And I asked one person why. And the answer was, when you watch a porn movie, you forget that that's a movie. And so you meet your partner, you're expecting, your level of expectations shoots through the roof, because you're expecting certain, which is not going to happen. Then you get frustrated because we're watching a porn movie. Do you have a comment on that, Dr. Adeline?
Of course, I do have a comment on that. I think people really have to be realistic. The question is, if people are going to indulge, watching porn movies is something that really is used in the medical field, particularly in clinics that really deal with sexual dysfunction, because that is the way. That is also a way in which they help treat, the patients. And not only that, it's also used in clinics that deal with infertility, because sometimes.
Tell me a little bit about the porn movies. How do you're a professional in this, you've been in this for many, many years. How does the doctor use porn movie to understand a problem of sexual dysfunction? How does it work?
I am not I don't practice in the area of sexual dysfunction. I do counsel my patients about having a healthy sex life. I have discussed sexual dysfunction with my patients. We have come up with strategies to be able to make their sex life better and to solve some of their problems. But I have not used pornographic movies, those are things that are used in specialized sexual dysfunction clinics. So I am not, I don't really have a special sexual dysfunction clinic in our practice. We don't have that. So I do deal with sexual dysfunction at a general level, and yes, I deal with it, and yes, I help my patients. But in answer to your question, I can tell you one video in the field of obstetrics and gynecology that porn movies do work. It might not really necessarily work for sexual dysfunction. It might work in infertility clinics where, sometimes, in cases where, there has to be in vitro fertilization, they put it in the bathroom, because if the men have to produce the boys, they have to use it to get aroused to produce the boys. So yes, it is used. In sexual dysfunction clinic, they actually use it to be able to systematically solve a problem. With respect to people looking at it, people have to be realistic, right? If you're going to go look at a porn movie and then you suddenly expect your husband or your wife to become the person that you saw in that movie, they're not going to be that person. So that is recipe for relationship failure. Then to me, that is gullible. If you're using it solely for the purpose of, trying to get aroused or trying to have a nice little intimate moment with your husband or your wife, then that's understandable. But just put it in your head that husband or that wife or that boyfriend or girlfriend is not suddenly going to become what you just saw in that video, because you're not going to have that person in that video.
If I may get back on vaginal dryness or painful sex, especially in part of the women,
yes.
What do you advise the woman to do? Go across the counter, go to the pharmacy across the counter, get some medication, or I don't know if I asked you this question before. Painful sexual intercourse, is it as a result of the man's size of penis, anatomy, or also the woman's, what do I say? The woman's anatomy that cannot take that size. Where do you draw the line? When does it become this problem and not this problem?
Well, obviously, like we said, sometimes size can be an issue, but it's not only about size, right? If you look at a woman and they have pain with intercourse, we refer to it as dyspareunia, and if it is because they have a gynecologic condition that is called endometriosis, we treat the symptoms of endometriosis. In some cases where it is because of fibroids, if it becomes very bothersome, we have ways in which we treat fibroids. If the cause of the pain is because they're advancing in age and they've lost or their ovaries are not producing estrogen at a very low level, or they've undergone surgery and the ovaries have been removed and put them in surgical menopause, that is going to come with vaginal dryness. That is going to come with thinness of the vulva. So there's certain things that we can do, and I deal with it almost on a daily basis with my patients. So I'll give you an example of what we can do. Lubricant are an option. You do have some lubricant over the counter. There's some that I prefer to tell my patients to use because I think they're better. That's one option. In cases where people, in some cases, in severe cases of vaginal or vulvar atrophy, we can give them topical estrogen, not as a lubricant. The estrogen is not functioning as a lubricant. It is basically you're giving back to the body exogenous hormone that was normally being produced by the ovaries, and I like to call it, it rejuvenates. So they take estrogen over time, and that also tends to help them. We also have another medication that has been approved by the FDA for dyspareunia, which is painful intercourse. So I prescribe this for my patients. So in answer to your question, I think people have to just get away that pain is just about size. Not necessarily. You do have some pathologic causes of that, and once you identify those causes, you can channel your treatment appropriately.
We will be rounding off this broadcast soon. Please get ready with some clinical points, take-home message for our viewers online, and we will be putting this broadcast many times at different times of the day at our watch parties, chat night watch parties, so that we're hitting different audiences. As we have discussed on this show since we started it, communications is to a relationship what blood is to the body. Cause a lot of sexual dysfunction at home. Dr. Adeline seems to have dropped off. You made one to recent. Sure that I hope your battery didn't die on you. Anyway, so you've had, yes, Dr. Adeline, I'm going to take you right back on now. And this is Africa. We are going to take some points from Dr. Adeline Nukuna. Yes, please. You're fine.
I'm so sorry about that techno glitch.
That's okay. You are back
on the air.
Now, what should be your take-home message? What should both men and women go home with after listening to you? Because people are really suffering in silence. These matters of sex, people are suffering in silence. I've talked to so many men who are married and who are so unhappy. I've talked to so many women who are married and so unhappy, but they stay there because of maybe they have joint property, or they have children, or they are worried about what people would think about them if they broke apart. If they broke apart. So, yes,
can you hear me?
Yes, please. Yes, go ahead.
Can you hear me?
Yes, please.
Hello.
Yes, go ahead.
Can you hear me?
I hear you. I hear you.
Okay. Let me go ahead and fix my volume here. Just give me a second, if you don't mind.
This is
that better?
Chat Night Africa. Night Africa. Yes, go ahead, please.
So so what I'm saying, if people are so unhappy, right? Can you hear me, or do we have some echo?
Go ahead. Go ahead. I'm hearing you.
Right. So if people are so unhappy, then let's talk about it, right? So what I would like people to know is that people do it, they just don't talk about it. Sex is a healthy part of any relationship. Every individual really has the right to enjoy their sexual life. So guess what? I think people need to be honest to themselves, open enough, hold an open discussion, identify what the problems are, and if it's a problem that has to do with the relationship, some of which we've already discussed, or problems that have to do with other things that are within their control, I would recommend that they tackle it and they fix it so that they can have. Can you hear me, Mr. Njamukong?
Yes.
So that they can have an enriching and a fulfilling sex life. In certain cases, some of the problems can be because of the medication they're taking, either antidepressant, high blood pressure medication. They should go see their providers, so their providers can look for alternative medication that can still treat their medical condition and yet have less sexual side effects. In other cases, if it's because of overweight, right, obesity, we talked about that, then get on that treadmill, exercise, go walking, try to work on that. But I'm saying that there is, in some cases, sex at 80 is not going to be the same as sex at 50. There are other alternative ways of enjoying a healthy sexual relationship that does not necessarily have to be penetrative intercourse. So there's no reason to just stay there and suffer in silence. The key is that you need to talk about it, and you need to find out the causes, and you need to also, if you can be part of the solution, be part of the solution. If part of the solution requires that you see your healthcare provider, go to your healthcare provider. Just don't sit there and wallow in the corner and suffer in silence and go to work and complain about it.
Thank you, Dr. Adeline.
Thank you, Dr. Adeline.
You exit the stage. I will launch the signature tune.
Thank you for coming on the show today.
My pleasure.
Thank you now.
Thank you now.
I'm coming back. I'm coming. Coming to get down. I'm coming.
And that has been Chat Night Africa special broadcast. We were talking about the surgical side. Do not pick a few dishes in the evening. Wash them because you want sex with somebody at 8 o'clock in the evening. Women know that. Women need a longer time to prepare. Women are more like light bulb switches. Flip, you come on, flip, you are off. I want to thank Dr. Adeline Nukuna for connecting from Delaware and for sharing all that information. We come to weaponize you, to equip you, because you see, knowledge is power. And the moment you stop learning, you start dying. It doesn't matter how educated you are. It has nothing to do with it. Like I said, so many married women, people in relationships, they're complaining, they're not satisfied sexually. Part of it is psychologically. Do not go get a house which you cannot conveniently pay for. Do not go get a car that you are not comfortable with monthly payments. Debt. Battered women don't respond very much sexually. Men who are not praised do not respond very well. I'm quoting Minister Veronica Fortune. Men love praises. If you want your man to perform like a horse, you probably need to really, really compliment him a lot. Men, that works on us powerfully. Thank you for watching. That has been Chat Night Africa. Next broadcast will be on diabetes. You don't want to miss that. Thank you. Share this broadcast. If you like what you've been hearing, please share this broadcast. Help somebody on it with the information. I will be posting the show on my wall immediately after I get off the line, so that you can go there and share and watch it all over. We will put it in several watch parties. If you have questions, Dr. Adeline will answer the questions. Please post your questions, even though the show is over. She will be in the green room to answer the question. I am your host, Divine Nchamukong. Thank you for watching. And that has been Chat Night Africa Live from Washington, D.C. metropolitan area.
We're gonna dance. We're gonna get down. We're gonna get down. We're gonna party.
Chat Night Africa, straight talk on matters that matter. We come with matters relevant to you. And sex is.
It's all right here. It's dynamite.
Minister Veronica says men don't want sex, men need sex. And I think women also.
I'm coming to get down. We're gonna get down. We're gonna get down. We're gonna dance. We're gonna dance.
And until next time, I want to thank all of you that have been online watching this broadcast. Again, please share this broadcast and help somebody with the information. Merci à tout le monde.
I'm coming. I'm dancing. I'm dancing. We're gonna dance. We're gonna dance. We're gonna party. Party hard.
Chat Night Africa.
We're gonna boogie. Boogie woogie. We're gonna dance. Side to side.
Chat Night Africa from Washington, D.C. metropolitan area.
I'm ready. I'm coming.
Thank you for watching.
I'm ready.
Merci à tout le monde. I will see you again sometimes soon.
I'm dancing. I'm dancing. I'm ready. I'm coming. We're gonna dance. We're gonna dance.
Bye-bye.
I'm coming
Bye-bye.
back.
I'll come back.
I'm coming back.
I'll come back again.
I'm coming.
That's a promise I make.
Coming to get down.
See you very, very soon. Bye-bye.
I'm coming to dance. We're gonna